Bonjour! Alright, it's me again, and I'm going to talk about the whole transplant process. I'm going to start out with a disclaimer here. This video is probably going to be really long because I am not very good at condensing things. I'm pretty long-winded. Oops. And also, another disclaimer. The things that I'm going to talk about in this video, I'm not going to lie, I'm not going to sugarcoat things too much. Some of the stuff that I did have to go through with transplant and then the side effects after weren't very fun. It kind of was pretty sucky, to be honest. And I'm going to talk about those things. And I don't want my experience and the side effects that I experienced, and I don't want that to come across as scary or anything like that. If you are in the position where you are contemplating getting a bone marrow transplant, I don't want you to get scared or anything like that. Definitely the benefit outweighs the negatives for sure, and I just wanted to put that out there and say that please don't let this information deter you. I just wanted to be honest and be truthful to my experience. So now that that's out of the way, I'll go ahead and get started. I had to make notes here, and there's like 4 post-it notes right here because this was a really big experience for me, and it was a long period of time out of last year that I was going through this transplant process. So, like I mentioned in the last video, I met with the transplant team at WVU Healthcare, and we decided, that the whole transplant process was the best way to go for me. So they started searching for a donor, and they actually ended up finding a perfect match donor for me. And like I had said before, it wasn't anyone related to me. Sometimes for transplants, they're able to find donors in the family. It's usually immediate family, like mom, dad, or siblings, which I don't have any of that. I'm an only child, and my mom and dad are both passed. So it was just me, and they had said that for my extended family, like my cousins, aunts, uncles, that the likelihood of them being a match to my HLA type would be just the same statistics that it would be for some random person across the world to be my match. So that wasn't really a viable option either. So what they did is they searched the registry, and they found a match, and he's a male, and I'm not sure how old he is. I just know that he's from outside of the United States, so he's somewhere out there in the world. And I hope to someday, either like communicate through letter, or I don't know. I just find it so amazing that this person who doesn't know me at all donated these cells to me, and saved my life. So, like I said in the last video, it's amazing. But anyways, so they found a perfect match donor for me. Pre-transplant process. So a week before transplant, I had to go up to the cancer center and do a bunch of appointments and tests and things like that. I had to do like a pulmonary function test to measure like how well I was breathing and things like that. I had to have a bone marrow biopsy done just to make sure that things were still okay and that it was safe to go forward with the transplant process. I had to meet with a social worker, a dietitian, a financial coordinator. I met with the staff pharmacist there for the cancer center, and she just talked with me a lot about the tacrolimus, which it's also called Prograf. It's the immunosuppressant medicine that you have to take whenever you have a transplant. So she met with me and talked with me a lot about that. I had to have a dental exam done to make sure I didn't have any infections or issues going on with my teeth. I had to have an echocardiogram completed to make sure my heart was okay and that it could handle the high-dose chemo. and everything. And I also had to meet with an ophthalmologist to have my eyes tested to kind of get like baseline, I guess baseline measures of how my eyes were, because you can get graft versus host and it can attack your eyes. Also, you can also, chemo can mess with your eyes. So that's why I had to meet with the ophthalmologist there in Morgantown. So I think that was all of the pre-transplant meetings that I had. So that was a week before transplant. The day before I was admitted to the hospital for transplant, I had to go up a day early, and I had to sign all of my consent forms, the consent for chemo and the consent for, the other doctors who were going to meet with me. And I didn't have to do this, but I opted to do it. I signed consent to participate in a clinical trial. WVU is a big teaching hospital, and there's all the time clinical trials going through there. So I opted to participate in one that they offered to me. It was a trial it was testing this new medicine to see if it helps prevent graft versus host disease. And of course, it's a clinical trial, so I don't know if I got a placebo dose or if I got the actual medicine. Not sure if I'll ever find out or not, but that was just an interesting option that I was given, and I decided to take that opportunity. So that was it as far as the day before transplant. My computer's being weird here. Okay. Sorry about that, guys. My computer decided to go wonky there for a second. Anyways, back to what I was saying. So that was pretty much it for the day before admission to the hospital. I was admitted to the hospital to start the whole pre-transplant chemo and whole transplant process on September 15th of 2017. That first day, I had to go in super early to the intravenous radiology thing. And what they did is they placed a Hickman line. And even though I already have a port in my left side of my chest, they said that they needed to place the Hickman line because something about the diameter of the catheter, that if they were to put the actual transplant in through the port, the catheter is too small and it would kind of eviscerate the cells, and they didn't want to do that. They don't want to damage these brand new stem cells that I'm receiving from the donor. So they put in a Hickman line, and the Hickman is a little bit bigger around, so it wouldn't damage the stem cells that I was getting. So I can kind of show you my scar from the Hickman line. It went right there in my chest. It looks like a wonky smiley face, kind of, my scar does. But there in the middle is where the main line came out, and that line came out and it separated into 3, I guess they call those ones lumens, and they're kind of like little tentacles almost, but that's what they can put the fluids in your transplant in, through those lumens. And then all the other scars around that main one were just from the stitches that kind of held the Hickman line in place right here. But the line, it went up like this. You could see it sticking out like under my skin, and then it went into a vein there close to my collarbone. But whenever they did that, they gave me some anesthesia. I'm not sure if it was supposed to put me under, but it didn't. So I was awake for the procedure, but they did it, like I said, through the interventional radiology department. And so they used like an x-ray type machine to see what they were doing. And the whole process was really quick. It wasn't painful, it just was weird because, like I said, I was awake and I could feel them like doing things, and like that, like, you know, I had to have my head turned and I was laying on a table, but I could feel them like feeding the tube up under my skin and it just was, it was weird, but it didn't hurt and it was over really quick. I was probably in the OR for maybe 15 minutes max. Like, it was very quick. But after that, they just wheeled me directly up to my room on the bone marrow transplant unit. Um, and then I just got to rest pretty much for the rest of that day. They did give me a dose of which is a medicine that prevents seizures. Some of the high dose chemotherapies can cause seizures, but luckily I didn't have any issues with that. The next day, which was September 16th, was actually my first day of the pre-transplant chemotherapies. So I got 2 chemos. The chemo regimen that I had, they call it Flubu. It was fludarabine and busulfan were the 2 chemos that I got. So I got those medicines on the 16th, the 17th, the 16th and the 17th, and then on Monday, the 18th, they added in another medicine. And this other medicine, it's ATG is what they call it. ATG is short for anti-thymocyte globulin. And ATG was the most rough medicine, I guess. I don't know how else to say it. It was very, very rough. The most rough medicine that I have ever had, to be completely honest. The chemotherapies I, you know, had in the past and the chemos that I had on the 16th and 17th, you know, they were manageable. It was just like, it was, you know, it was chemo. I don't want to, you know, downplay chemo, but it was chemo. But this ATG was on another level. It kicked my booty up, down, all around. It was rough stuff, but it is rough stuff for a purpose. The ATG is actually derived from rabbit antibodies. It could also be derived from horse antibodies, but they used rabbit in my case. But it's derived from these antibodies, and it's supposed to I guess, weaken or against human T cells, which helps prevent rejection, helps prevent transplant rejection. And it wipes out everything in you. And it's rough stuff. I'm not gonna lie about it, but it's doable. You know, I survived. I made it through. So don't let me being negative or being, you know, honest about this deter you, like I said earlier. But so I had the ATG, I had that, and the chemos on the 18th and the 19th, and then on the 20th, I just had the ATG. So I had that for 3 days in a row. And then on the 21st was a rest day. I didn't have any medicines, any chemos that day. And then on the 22nd was my transplant. That's whenever I received my donor cells. I'm look at my notes here, sorry. The ATG, the first day that I had it, the doctors did warn me that very first dose of it was going to be the roughest. And they said to expect just feeling really sick and to expect fevers and everything, just to feel like you got beat up, basically. And that's how I felt. You know, it was exactly what they said. I did have a fever that night from the medicine. You know, they did all kinds of tests just to make sure that it wasn't from an infection, and you know, everything was negative. It was from the ATG, so that was, you know, spot on, like the doctors had said. And then that's pretty much it as far as like major side effects that I had right around that period. You know, of course, I felt, you know, very nauseous. You know, but they, you know, stay on top of that nausea, like I had mentioned before in a different video. You know, the nurses have several different medicines they can give you to fight nausea. So, some still creeps up in my case. Some nausea it just wouldn't go away. But for the most part, it was kept under control. But yeah, my actual transplant on the 22nd, it was very, I don't want to say lackluster because it's such, a big deal, but it was very chill, I guess. I woke up that morning and took a shower and got dressed, not knowing exactly what time the transplant was going to be, so I was just kind of relaxing in my room, and, they came around 11 to start getting things ready. They, like, the guy who brought the cells up from the lab, he just came in carrying this bag of cells. It looked like a blood transfusion, basically. It was just a plastic bag, and it had the IV tube or whatever it's called attached to it, the line attached to it, and they didn't even hook it up to an IV pump or pole or anything like that, like how the chemos, it went through an IV box. I don't know what that's called. My brain isn't working. But it was just, they hung it up, and it just went in through my body just through gravity. So that was different. That was unexpected. And the whole process of getting the transplant took maybe half an hour. It was very quick and very lackluster. Like I said, I hate that word, but it was. So it was interesting. They let me hold the bag after, and I got my picture taken with my new cells. It was really cool. And the nurse who was there in the room with me during my transplant, she was really awesome. So it was a good experience. Getting the actual transplant was a good experience, and my aunt was there for it, and it was cool. So that was the 22nd. And then, from that day on, it just was a matter of waiting for my blood counts to recover. The chemo, the flu that it knocked, my white cells down low. But then once I got the ATG, it was just like that. Like, my immune system was gone. My white cells were down low, like 0 low. And so, we were waiting for that to recover, just like, after, you have any other kind of chemo. You have to, wait for your white cells to recover and, get back up to normal before, they'll let you go, just because your risk of infection is so high at that point, just because you don't have anything to fight off, these germs and whatnot. So that took a couple of weeks for my cells, to recover. And the cool thing was, it wasn't, actually I shouldn't say it was my cells. They are my donor cells at that time. This was really the true test to see how my donor cells are going to do in my body. Are they going to recover, or is it going to, not stick? We just didn't really know what was going to happen at that time. So that was, kind of just a wait and see period. And, for some reason, during this whole hospital stay that I had, the hospital was awesome. And the staff and the nurses, like, they were awesome. But I just was not feeling it. I just didn't want to be in the hospital. I'd been in the hospital so much already, that year. I was just over it, but I had to be there. So me being, like, negative in that sense kind of made this stay a little bit rougher than it should have been. But, what can you do? That's just, I was positive in a sense, but other senses I wasn't. But, that's just life. Looking at my notes here. I did lose my hair with this chemo, with this, regimen. I had lost it with my induction chemo, but then I didn't lose my hair with the one round of consolidation chemo. But with this, I did lose my hair. And I started losing my hair about a week and a half after I had completed the chemo. So it's pretty spot on with what happened the first time. And I didn't have a ton of hair to lose, but I did have a little bit of growth coming in from, from the time between my chemos. So that, that came out, and I tried to video record my hair coming out, which was probably like gross in hindsight, and people probably don't want to see that, but I just thought it was interesting because, people have asked me about it before, and I don't really know how to, explain it, because whenever you're losing your hair and you can just like touch it and it comes out, you always think that, pulling on your hair, it's painful and your hair doesn't want to come out because it's, in there, it's in your scalp. But once you start losing your hair because of chemo, there's no pain with it. You can take a chunk of hair and just pull it and it comes out in your hand. So that's, kind of the reason why I recorded it. I probably might slip a little bit of that video in here just so you all can see it. If you are grossed out by my hair coming out, you can just skip over the video. But I just wanted to like document that for myself, and then maybe, if you all want to see it too, cool. Anyways, so I lost my hair, and instead of just like letting it all fall out, I just got a razor and just, shaved my head with the razor, and it doesn't bother me. At that point, I was completely used to, not having hair, so it wasn't any big deal. The next thing that happened while I was in hospital recovering from my transplant is it's called mucositis, which it's mouth sores. And I know that commonly happens to people who who go through chemo. I just had luckily not gotten it before this point. But let me tell you, that was some painful stuff. It was so bad. I'm not gonna lie about it. It started out with kind of almost felt like a sore throat a little bit, and I kind of was just talking funny like how I do whenever I have a sore throat. And I tried like the chloroseptic spray. I tried just cough drops, things like that my aunt had brought me, and it wasn't working. It wasn't, I guess it just wasn't the right kind of stuff to ease that. And then the sores, like the pain like spread like from just in my throat. It started spreading to my mouth. And I had raw spots, like it was, spots that would bleed, and it was just so terrible. And like on my tongue, under my tongue, it hurt very bad to talk. I could not eat, I could not drink. It was impossible for me to swallow. It felt like I had this big, like, almost like lump or something, like in the back of my throat, like on the back of my tongue, that it just felt like everything you put in your mouth to swallow had to go up over this like lump and like scraped down your mouth and scraped down your throat. It was painful. And they did put me on a pain pump to try to manage the pain. And for those of you who don't know what a pain pump is, I didn't know what it was either until I had one. It was just a pain medicine that they put in this locked box, and they have it on a cycle where you get a little bit constantly of this pain medicine, but they also have this button that hangs down, and you can get a special, I think it's called a bolus of it. You press the button and you eat every 15 minutes. It will reset so that you can get more of the pain medicine if you need it. So I had that for maybe a week. But honestly, it didn't help me. I'm not sure if it was just the kind of pain medicine that I had or what, but it didn't help me with the pain in my mouth. It did help me sleep a little bit. I was able to nap and things like that with help of the pain medicine. But as far as actually helping the pain so that I could eat or drink, it didn't do that. And they also gave me, it's, whenever you go to the dentist's office and they have those mouth suckers that they stick in there, like the spit suckers, and sucks up, like the water they spray in there, and it sucks up your spit to kind of dry out your mouth. They gave me one of those just because I wasn't able to swallow anything, and trying to swallow my spit was just absolutely excruciating. So I had this spit sucker that had to keep in my hand basically, and if someone came in to talk to me, I had to like stick it in my mouth, and it made like the most disgusting sounds as it was like sucking the spit out. But I had to do that every time someone like was talking to me, and it was embarrassing, but what can you do? So I had that. I'm trying to think how long total I had this mucositis going on. It was, I want to say, maybe it was over a week. And the only way to really get rid of it was for your counts to recover. So I just had to wait and try to get through until my white counts recovered, which they eventually did, of course. But once they did recover, it went away pretty quickly. So that is one plus. I think that's pretty much it as far as like major things that happened while I was in the hospital. I did start to get this weird hand rash. It started like around this area of my hand, and it spread across my palm, and it was very, very red, and it was very, very itchy. And I just would rub my hands together constantly because it agitated me. Like it just was so itchy and so painful. And I asked my doctor, I told him about it, and he instantly knew what it was. He said it was hand and foot disease, and not hand, foot, and mouth. It's different from that. It was called hand, foot disease or hand, foot disorder, something like that. And it's caused by the ATG that I had. Also, something that came up while I was in hospital. With the whole, transplant process, it, completely wipes out your blood system and replaces it, of course, with with new stem cells that's building this new blood system. And the anti-rejection medicines and the immunosuppressant medicines mess with your levels of electrolytes in your body. I had trouble with my magnesium levels, and the way they replace magnesium is they do it through IV. So you have like an IV bag of this magnesium, which runs over 2 hours, I believe it takes to put this little bag in you. And I had never had magnesium before. I don't think I ever had it while I was in my first hospital, but I had it a lot at this hospital and with this, transplant experience, and I ended up having a bad reaction to the magnesium. I would get really itchy and like really hot. It really agitated that rash that was developing on my hands. It was terrible. It seemed to like it just made that really, really itchy, and like nothing would really alleviate it. I did, running cold water on my hands did help, but of course, the magnesium is still going into your body, so it didn't help for very long. But they ended up starting to like pre-medicate me prior to getting magnesium, so they would give me some Tylenol and they give me some Benadryl, and that helped a little bit, but not much. And eventually my doctor was kind enough to give me prescription for magnesium pills, and that helped a lot. And once I started taking those pills, I never had to have an IV infusion again, and the pills didn't affect me at all. I never had any side effects from them, like I did with the IV. So that's just a little FYI. If you are having weird symptoms after or during your magnesium infusion, you might be allergic to it or whatever I was. Then, let's see, around this time is whenever I was actually discharged from the hospital. But because I live 2.5 hours away from the transplant hospital, I had to stay close by. People who live close to the hospital, I think they're allowed to go home at this point, but since I live so far, I had to stay in a house that was close to the hospital. It was actually just right across the parking lot. It's a family house, and they give special rates to patients who, like me, patients who had to go back and forth every day for transplant related stuff, and also they allow families to stay there, families of people who are inpatient in the hospital. It's similar to a Ronald McDonald House, if y'all know what that is, but it's for adult patients. The Ronald McDonald House was like right next to it, so they have all that stuff there. But I had to stay in the family house from the date of my discharge, which was October 10th, and I stayed there until November 30th. So I was there for almost a month and a half. And at first, I had to go over to the hospital, over to the cancer center to get my blood checked every day. And then thereafter, my doctor made it where I have to go every other day, and he slowly started weaning me down to where I wasn't going, except for 2 days a week. But while I was, in that transition period between the hospital and the family house, some other things started to crop up. My skin after transplant became incredibly sensitive. It wasn't sensitive. It wasn't like a graft versus host thing. It was actual just sensitivity. Any kind of lotion pretty much it would make me itch. Like, everything made me itch. I was so uncomfortable all the time, because even like my clothing just touching my skin, I just felt so uncomfortable in my own body. You know what I mean? It was bad. And where I had the adhesives protecting my Hickman line, the adhesives were like leaving like red marks on my skin. I had to always, cover up my line whenever I would shower, and it's like a piece of like plastic that has tape around it, is what they used to cover, and that tape was actually ripping my skin off, so I had big, like, almost like open wounds, like these big like scab or skin irritation marks all over my chest and on my arm and my armpits. It was uncomfortable, very uncomfortable. And then I started to get dark areas on my body. This kind of happened while I was at the family house, recovering. They call it like in the hot zones, so like your armpits and like under your chest here, and your bikini line. I'm trying to think where else, like your knees, things like that. They started to get discolored and turn dark. Like, so you got some like dark skin, and it was really itchy. And that was from the ATG. Another thing that was from the ATG. That did eventually clear up, and the itchiness all over and the sensitivity did eventually get better. My skin today, it still is a little more sensitive than it used to be, but it's better than it was for sure. My hands, the rash that I had told you all about that was on my hands, it eventually, I had it on both hands, and then it eventually spread to cover my entire palm. And my entire palm had that red itchy rash. I wasn't able to do things, like I couldn't open bottles of water, and just things like that. Medicine bottles, I wasn't able to grip them enough to really unscrew the lid. It's kind of almost helpless, because I wasn't able to do much, just because my hands were so painful. And then after that red rash was there for a little bit, my hands started to peel. The skin on my palms started to peel off, which was really bizarre. And then after that, I started to get these weird, like, bumps almost. It looked like a rash on the back of my hands, but it wasn't graft versus host. You know, the doctors confirmed that. It just was, all of this was just side effects from the ATG. But again, you know, you can see today my hands are, you know, clear now, but there for quite a while after, they had some pretty bad stuff going on with them. Also, while I was at the family house, my nails started to grow out. Of course, you know, they started to grow again after the chemo, and they started growing with dark ridges, like dark circles, kind of. Whenever they grow out, you can see a dark line, and that's common from chemo. And then they continued to grow out, and they actually started to flake, kind of. It kind of looked like my nail had broken, but it had broke like across this way. It was weird. I'm not sure if I have a picture of that or not, but if I do, I will put it here in the video so you all can see what I'm talking about, because it's really hard to explain. But so I had the nail issues there while I was at the family house, and then more recently, whenever I've been home, the same thing happened with my my toenails too, actually. So that's from the chemo, like I said. It just damages your nails as well as other things. But that's pretty much all I have on my little my list here of things that were happening, you know, while I had transplant and then after transplant while I was at the family house. I will say this just for, you know, random FYI. I did find out, and I heard that if someone does not have a caregiver, that transplant may not be an option for them. And that's kind of, you know, a worry for me, because like I said earlier, you know, I'm independent, I'm by myself, I don't have siblings, my parents are gone, so I have, you know, my cousins and my aunts and uncles, and that's it. You know, I have friends, of course, you know, here, and a lot of support from my community, but if I wouldn't have had, you know, caregivers available, I heard that I wouldn't have been able to get a transplant. So that's kind of just, you know, that's surprising. But, I mean, it makes sense, I guess. You know, the caregivers are there to just make sure everything is okay. Like, thank goodness, you know, I never had any, you know, major complications once I was released from the hospital or anything like that. So I think, you know, hopefully I didn't stress out my caregivers too much. I tried not to, but yeah, once you are discharged from the hospital, in that period while I was at the family house, I had to have a caregiver around 24/7, just in case, you know, if something were to happen. And they also, you know, help, you know, remind me of things, because I did, like, my memory and concentration was, you know, still really bad for quite a while there after transplant, and even still to today, I do have memory issues and concentration issues too. And, you know, sometimes you can probably see it, you know, throughout these videos that I, you know, sometimes struggle to find a word. I don't know what I'm going to say next. I lose my train of thought. And that's just something that I have to deal with, you know, today even. I'm hoping that, you know, someday that will go away and that my memory will come back, you know, to how it was before. But who knows? I'm at I'm day plus 140 today, so I'm 140 days out from my transplant, and, you know, I'm doing well. I'm doing well. Of course, I still have, you know, some complications going on, but, you know, I'm definitely lucky. You know, I know a lot of people aren't so lucky, so I find it bad. You know, I don't like to complain or anything like that, but, you know, I'll talk about in a different video, a future video, I'll talk about some of the things that I still have going on, with me today. But overall, I'm doing good. I'm well on my way to recovery. So that's pretty much it. I'm looking here to see if I missed anything in my notes. Um, Whenever I was released from the hospital, I was at day plus 18. So what they do is whenever you have your transplant, like the day of your transplant, so for me, September 22nd, that day becomes your day zero. They call it your rebirth day. And then from that point, they start counting upwards. So the 23rd was my day plus 1, and then 24th was my day plus 2. I was in the hospital and I was released until day plus 18, so that was October 10th, was whenever I was let out. I was in the family house, like I said, until November 30th, which that was my day plus 69. So I was able to go home for good on day plus 69. Once I was allowed to go home, I call it home because they did allow me to have home visits on the weekends, but I wasn't allowed to go home and stay home until November 30th. But once I was home, I had to go to the doctor once a week, and then he dropped me down to going once every 2 weeks. So, and they still, every time I go, they still, check my blood and see how my levels are doing, do all my vital signs, and, I meet with the doctor every time I go. So, that's pretty much it. Oh, here's another one. Sorry. While I was in the hospital, after transplant, I received 3 blood transfusions and I received 3 platelet transfusions. Like I said before, I kept track of all of that, just to know how much blood and blood products I had to receive during this whole process. So, actually, after transplant, that was that's the least amount of transfusions that I had to receive compared to any of the compared to the induction chemo and compared to the consolidation chemo also. So also before I was officially released to come home, I did have my Hickman line removed. And that was a really simple procedure. I just went back to a room, and they put lidocaine injections all around that spot. And then they just, cut the stitches, and they just pulled it out, and that was it. I wasn't under any anesthesia or anything for that. It took, again, maybe 15 minutes total for the whole thing. And they just put a bandage on it, and that's it. And then, it healed up on its own with no complications, thank goodness. One of my biggest fears with transplant was having an infection or having my Hickman line get infected. Is because it is, it's an open wound, it's open area. And I just was so afraid that was going to get infected, but thank goodness, it didn't. I made sure to keep my hands, really clean all the time. And I showered daily, and I think that really helped cutting down on the risk, cutting down on the chance of infection, not just for my Hickman line, but for everything. I was very lucky I didn't get any kind of sickness while I was in hospital, while I was in the family house, and even since I've been home, knock on wood, I haven't had any kind of sickness. I haven't caught the flu or anything like that. So I've been very lucky and very healthy, and I just, I can't express my gratitude to, everybody, and, everybody who's helped throughout this whole process. But for real this time, I think that's it as far as the whole transplant process. Like I said, this was going to be a long video, and I definitely was not lying about that. I'm sorry, I'm not, I can't, I don't know, I can't give brief explanations of things. I just want to make sure people who are going through this or getting ready to go through this, or who are just interested, whatever it may be, I just want to make sure people will completely understand. And if I didn't explain something clearly, or if you all have more questions or whatever, just let me know, and I'll either answer you in the comments or make another video, whatever. So I hope that this was some good information for you. My next video that I'll make will probably I'll probably talk about my symptoms and things I still experience today from the transplant and from the chemos and whatnot. So I'll have that up for you here sometime soon. And so in the meantime, just let me know if you have any questions, and take care of yourself.